17 Americans aboard a cruise ship exposed to Hantavirus will be quarantined in Nebraska as 6 states monitor for possible cases. It comes as the CDC has classified the outbreak as a, quote, level 3 emergency response. But President Trump is urging Americans not to worry.
We seem to have things under very good control. They know that virus very well. It's been around a long time. Not easily transferable, unlike COVID. But we'll see. We're studying it very closely. We have very good people studying it very closely.
Here with more information is NIH Director and Acting CDC Director, Dr. J. Bhattacharya. Dr. Bhattacharya, so great to have you on. So tell us then, how is the hantavirus transmitted?
Well, you have to be in close contact with someone who has a lot of symptoms. There have been 8 people that have been infected. All of them, the first 2 got it from, for all things bird watching, probably breathed mouse droppings in Argentina. And then people who were very close to them, the roommates, a doctor who was caring for them, they're the ones who got symptomatic. You have to be in close contact. The president's absolutely right. You're not going to spread it just the way COVID spreads. You have to be in close contact with them.
So if you don't have to be in close contact with them, what will happen to these? They're going to be quarantined, but you're not concerned at all about the rest of the population, correct?
Absolutely not. That's a real important message to get across, Rachel. This is, again, not like COVID. And the CDC has been working very closely with our international partners, our state and local partners. We have a team on the ground that's going to help these 17 Americans, bring them back to a facility in Nebraska. Had a great call with the governor of Nebraska this morning. And what we'll do, it will be a self-isolation. None of these folks have any symptoms at all. We're going to have them isolate for about 42 days. That's what the literature says. We've handled outbreaks like this before. I think in 2018 there was an outbreak in the United States. My message to the American people is, please don't worry. This is not one of those things like COVID where there's 15 different alarm bells. And the CDC team that is tracking this is absolutely amazing. We've been working with the partners across the government. They've been doing an incredible job, Rachel. Yeah,
I mean, my understanding, and you can certainly confirm it, is that the CDC, NIH, you guys have the foremost experts in this particular virus, coordinating all of this. Let me ask you this, because a lot of people watching this say, what is it about cruises and these viruses? What can be done to make sure this doesn't happen again on a cruise?
Well, I mean, the thing about a cruise is it's close quarters, right? So it's hard to normally if you go home and you have even some space between your neighbors and you're not going to spread this. It's close quarters. I think this cruise was going around for about a month and a half. It's one of those expedition cruises. It wasn't like like a Carnival cruise or something. The 2 people that got on, they were in their 80s. They were bird watching. That got the virus in Argentina. Unfortunately, they died. But they had a roommate or someone who shared a bathroom with them who then got it because of close contact. Cruises put a lot of people in close contact.
Would going out on the deck a lot be helpful if you're on these cruises, just getting fresh air? And is that helpful in any way?
Fresh air definitely matters. I mean, it's definitely. I mean, there's better practices and worse practices. It's hard when you have a cruise like this that is it's an adventure cruise. They were traveling around for a month and a half in relatively close quarters.
Last question for you, Doctor. Are there any lessons from how COVID was handled that is informing how you handle viruses, whether it's this or any other virus moving forward? Because there were a lot of unconstitutional things that happened, and now I think people might be more skeptical about following CDC and NIH, instructions after a virus.
I mean, I completely agree with you, Rachel. I was a big critic of the COVID lockdowns and school closures and all that. But here, I think what you have is you have to follow the actual science. You have to communicate clearly with the American people what we know and we don't know, and don't panic, don't overreact, but do stay on top of it. Bring all the best people together to take a look at it. And that's exactly what's happened here.
Well, you were nothing less than a hero during the COVID period, and I'll certainly follow what Dr. Bhattacharya says over Fauci any day. So I appreciate you joining us, and I'm always so grateful for your voice during that dark period that we shall never forget.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.